Authorization is no guarantee of coverage.
We're talking about lives and American people here.
They will notice if somebody had a hangnail in 1987.
Hi, I'm Dr. Peter Weiss, and this is Medically Incorrect. I get asked quite a bit by how many patients I see and how much time is actually spent on seeing and taking care of the patients. It really does vary, but for the most part, about half of what we as doctors do, including myself here in this office, half of what we do is to paperwork. We keep that off camera because that stack is too high and it'll scare you, but it's really what we do. There's paperwork, there's phone calls. Between the 40 and 50 patients that we see in a day, have another 40 or 50 phone calls, plus callbacks to patients about lab tests, lab results. Everyone talks about what we do is seeing patients, but the problem is as we go further and further down the line, there's less eye contact, there's less direct contact between me and you because of all the paperwork. But that's the problem that we have to fight, and we're going to meet Debbie in a few minutes, and she's going to show you what we go through every day to fight for you.
Everything is all with codes. There's a procedure code. Let's say a doctor is doing a hysterectomy. There's a code for that. Let's say it's 58555. They're going to go by that. They go, what's the diagnosis? Then you say 218.9. It's like all these logos like, OMG, it's 218.9. It means she has fibroids. But even then they might say, well, now I'm going to have to patch you through to a clinical review nurse to see if it's, can be authorized. I go, almost like, this is a true medical necessity. This isn't somebody saying, they want a breast augmentation or they want to get liposuction. You could see, according to our notes, she has a huge fibroid that would be equal to a person who's 4 months pregnant. It's like the size of a grapefruit. She clearly has excessive bleeding, but yet it's not good enough that the doctor said she needs to do it. They got to go to the nurse. Okay, then they transfer me and she goes, okay, then I have to go over the whole thing again. Then they want to go, what's the clinical diagnosis? Then finally she goes, now we'll fax you back within 24 hours our decision. I go, oh, okay, fine. And then they don't always get it back to call. I go, here's my authorization, my reference number. We need to know today. Then, they let it go through. But it's like so much jumping through hoops. And that, is clearly the bane of my existence. I would have to say that's when I hear I got to authorize a surgery.
I, as a doctor, write medically necessary. You would think that that would be enough. If I'm a board-certified physician in that specialty, that should be enough for the insurance company to say, all right, I must pay. But what happens is, insurance companies have this caveat. When they say medically necessary, it's their definition, not yours, not mine. And they usually have somebody who is not board-certified in that specialty, a semi-retired doctor, who is going to decide whether or not that procedure should be covered. And by the way, who pays those doctors? The insurance companies. If they authorize all of the procedures that you recommend, they're not going to keep that doctor around much longer. They're going to find somebody who's going to deny a certain amount of claims. So the problem with medically necessary, it shouldn't be the insurance company's definition, it should be the medical definition. What I propose is that if a physician who is board certified and is a provider for that insurance. What a provider means is that if I, as a doctor, have a contract with a particular insurance company, that means I'm accepting already a reduced rate in service, and it saves money for the patient and the insurance company. If I am that provider and I say that you need a CAT scan or a surgery, and I'm board certified, and I've been already provided for that patient and that insurance company, they should authorize it without any question. It shouldn't even be an issue. Hi, we're here at a surgery center. For those of you who don't know what the term is, a surgery center is a full-blown operating facility, but in a much smaller package that provides everything that a hospital will provide at hopefully a cheaper cost. I had a chance today to speak with several other doctors and scrub techs about healthcare today. Physicians and the nurses and the technicians, we're on the battlefield. We're the front line of healthcare. But nobody seems to be asking us what we think should be done. So I'm going to throw it to you. You have a chance now to fix healthcare. What is it that you would like to see done that you think would make a difference?
The biggest thing, and the thing that I have the most sympathy for, are actually patients who pay high insurance premiums monthly to have what they think is insurance for health care. And then when they have a claim, an illness, essentially insurance companies look around for a way to disallow them as clients and thereby not to have to make any payments. And I think of this as sort of lessons that the healthcare insurance industry learned from the auto insurance companies. As everyone is familiar with, auto insurance companies are very happy to have you as a client until you get in an accident, and then they don't want to pay anything. So likewise, health insurance companies are now collecting healthy premiums, and then when a client has a hospitalization, particularly a serious one, they will actually go back. This is something that's documented in numerous cases in the past. Go back and look through the initial application, see if they can relate it to the current illness, and try and disallow the claim.
How about your patients? Are they complaining when they come in? Do you hear the stories? Or?
We hear the stories. A patient comes in and they want to have a particular surgery, and they'll call their provider, and it's like, well, why do I have to pay so much out of pocket, to go to a surgery center and have this done? It's a problem. They complain all the time. In healthcare, in the economic times that we're in now, nobody wants to pay any money to go and have surgery. If you have health care, I think we're under this impression that your health care takes care of everything. But if you read the fine print on your policies, you'll find that's not true. And a lot of people are unaware.
Okay. I said I wouldn't just complain about our system. So here are some solutions. This is what we should do. Number one, insurance companies must be allowed to cross state lines. This allows real competition. Number two, affinity groups such as AAA, Costco, your church should be allowed to purchase health insurance, and individuals who are members of those groups should be allowed to purchase that insurance without regard to pre-existing conditions. This insurance isn't free. People will have to pay for it. The buying power of such large groups will drive competition in favor of the patient. Number three, for those who get insurance through their employers and either lose their jobs or have COBRA should be allowed to continue purchasing that insurance at the rate that the employer was paying, not the double or triple rate that COBRA charges. While this will help, we must remember that insurance was meant to be only for major catastrophes and illness, not for everyday mundane problems. We really should pay for simple office visits, blood pressure checks, pap smears. If we want to curtail these exorbitant insurance costs, we need to take ownership of our expenses. Until we do, we'll have an uphill battle. Another issue to consider is just what is insurance. Home insurance doesn't pay for you to change a light bulb or fix a broken window. Remember, the real culprit in our health insurance dilemma is the cost. It's not the access, it's not the quality, it's the cost. If we pay for such basic services, as I've stated, we should be able to drastically reduce insurance costs, at least to a very manageable level. Major illness insurance is what should be strived for. We do not need policies that cover everything under the sun. Could you imagine what auto insurance would cost if it covered gas? If we follow through with these suggestions, then the true 12 to 15 million Americans who cannot get coverage because of pre-existing conditions would be covered without the trillion-dollar price tag. I'm Dr. Peter Weiss, and that's my second opinion. Please email your comments and questions to me, Dr. Peter Weiss at PJTV.com. For Medically Incorrect, we wish you a safe and healthy week.